Hello, my name's John Bradbury, and I work in the EMA's People Experience practice. And this EMAcast is an episode where we're going to look at workplace health and about organisations, what they can do in order to build sort of more healthy workforce. And in order to look at that today, I'm really pleased to have with me Kate Bukowski, who is a health professional who works now at Southern Cross. I was really interested in getting Kate in because whilst the EMA and NIB did a workplace wellness survey last year with some very powerful results, I know Southern Cross also have done some surveys over a number of years looking at changes and looking more broadly perhaps at healthy futures, as they call them. So in terms of starting this podcast off, I'd like to really welcome Kate today. And maybe if Kate, you could say a bit about your background, I think would be helpful for people.
Great. Thank you, John, and kia ora, and thank you for having me in today. So my working life has been a little bit different from some of the people that you may have had on and some of the people watching today. So I work in healthcare, always have. I started off as a clinician, very much as an ambulance at the bottom of the cliff, seeing high-risk people. And I did that for a number of years, and by the tender age of about 28, I managed to burn myself out.
Right.
So I took some time, went overseas on a holiday, and was still burnt out. So I decided to pick up my master's, which was going to be a clinical master's, and refocus that on public health. So I did my master's actually on homeless women in central Auckland, and then started to work much more in the upstream area of population health. So looking at how we could prevent those ambulances from falling off the cliff, and looking at how we could look at a more population health approach to improve people's health and wellbeing through a health equity lens.
Fantastic. And now the role that you're doing at Southern Cross?
So I joined Southern Cross nearly 2 years ago, and I was really excited with the work they were doing because they've moved from a hospital focus, and that's where you associate Southern Cross with the bricks and mortar hospitals, to healthcare. So what I've done over the last few years is set up a workplace health service, bring together the skills and expertise of 4 joint venture partners that include nursing, mental health, counselling, psychology, physio and OT space. So now we're able to offer to New Zealand businesses a really comprehensive workplace health. So to help companies meet their health and safety obligations, so with our OTs and our OC health nurses, right through to ensuring health, wellness and preventative care.
Okay. And in this role at the moment, you've kind of moved out of the sort of health profession, if you like, I see it, into you're part of the HR team there. Is that right?
So I sit in the strategy and partnerships team, and I'm working closely with HR. First time I've worked with HR professionals. You're a great bunch. So it's been interesting because what we do with workplace health is often it starts with a health check. So employers will fund a 30-minute health check with a registered nurse, which looks at employees' individual risk factors and health and lifestyle. So looking at the risk of diabetes, the risk of cardiovascular disease and the risk of mental illness. And the nurse is able to give some really good individual lifestyle advice in those 30 minutes. But it also gives the organisation and your HR department a real litmus test on what are the risks of your organisation of somebody having a heart attack at work or somebody having a mental health episode. We're able to, through our partners, provide immediate response. So we have RAISE providing EAP counselling services, and we also have Care HQ, which is a virtual GP service. So that's great for the people who may not have a regular GP or just can't get in and need to talk about something urgently.
Oh, fantastic. So, like some services there, clearly. But in terms of that for organisations, sort of what are you noticing in terms of perhaps changes that are happening that organisations are perhaps coming to you or in discussion with them? What are businesses kind of looking for, have you found?
The people who are investing are ones who want to invest in the wellness of their employees.
Yeah.
Of course, it comes back to productivity,
Yes.
reduced sick days, all of those real tangible things for an employer. Also, reduced ACC claims. If you can stop somebody going off work with a back injury, you have ACC claim savings there. Yeah, but what we're trying to do is with all of the interventions and all the services we provide, have a really good annual conversation with what is the main stresses for the employees. So, unsurprisingly, people are getting bigger.
Yes.
There's a really high risk of type 2 diabetes. Most organisations are around the 45% mark. There'll be a group of people who are at risk of having a heart attack. And from the assessment screens we do in the area of stress, anxiety, depression, there are usually about 10% of employees who are at that really high end. But when we aggregate that data down, if we have enough information so it's confidential, we often see a difference in demographics.
Yes.
So women are drinking more harmfully than men compared to World Health Organization standards. We still have groups around the country who are smoking and vaping at really high levels. We have groups who are really physically inactive. We have groups who are having sleeping issues, and people who aren't getting those 5+ a day vegetables and their fruit. So it's all of those things that a wellness program can start to really focus, instead of doing something blanket, really focus on groups who need the most help.
Right. So that sounds like taking quite a kind of tailored approach, being really understanding what your workforce is and what their needs are. Now, if we take a kind of step up, lift it up, you know, with this Healthy Futures report, you've got data over a number of years, and obviously there's sort of trends there, and there's a wealth of information there. But what for you are actually the real key standout things for that you think, you know, our businesses should know about?
Definitely. I think one of the things that stood out for me is that a lot of people's main form of exercise is doing the housework. I'm not sure if you read that too. So, you know, upping it a beat from actually, you know, supporting people to have more physical activity in, whether it be in work or out of work. So that might be less about subsidising gym membership, because what we know is that people who are likely to take up a subsidised gym membership are probably already going to the gym, you know, or a stock standard nutrition seminar. When people know those people who are going to come along probably have a level of health literacy. So instead it's really focusing in, consulting and talking, if you have a Māori governance group, or if you have a consumer group, or if you have a union, actually talking to them about what would work and what they'd be interested in actually accessing.
Yeah. So that's that kind of tailoring piece again, sort of understanding there.
Spot on.
And you talk about sort of differences between different groups as well. Tell us a bit more about that.
So definitely in New Zealand, we still have a huge difference between urban and rural populations. We've seen that in the people that we've worked with. So your head office in central Auckland is going to be very different from a factory in New Plymouth. Not only the culture around how people's, what they eat if they smoke, and things can go terribly wrong. So if you don't consult, you can actually have an increase in smokers. So one factory decided to make, in the best intentions, their factory smoke-free and have a designated smoking area off campus. What happened? They got more smokers because everyone wanted to leave the factory and go out and have a catch-up with their friends in the smoking area.
Right. So even perhaps non-smokers were going off. And
Totally. So the best intentions, you know, you have a very standard canteen and you have fried food in it. You remove it without consultation, you can get backlash. So that consultation around moving people is, what you HR experts do, is changing the culture in an organisation needs to be done in partnership.
Right. And, you know, often with these things, you know, the question is, you know, so in terms of your own organisation, what sort of things perhaps has Southern Cross done, you know, for its own staff? And what's your sort of influence and role there?
Yeah, definitely. So our awesome CEO, Chris White, said that if we were offering the service to other people and offering it as a business, your proposition, we should be doing it for our own people. So we do have EAP counselling available through RAISE. We've been doing some training of senior leaders on resilience training, so that's tailored training that we can do for organisations. We have done the health check for our people, and hopefully we'll do it in 12 months' time to see if our wellbeing program has made a difference. We do have a wellbeing program, so we bring in our partners. We are basing it around 4 quarters of eating, thinking, sleeping and moving well, which is something that Southern Cross members, corporate members can access through their corporate scheme. So it's a really nice web tool where wellbeing managers can pull information and use and tailor for their staff.
Yeah, okay. So, I mean, things that I'm noticing there as you talk about that resonates with a conversation I had a while ago with Chris Hewitt, and he talked about, the time for kind of initiatives had kind of gone. What was important was a kind of strategy around it. So, you seem somebody that takes a very long-term sort of view of these sort of things and coming with the skills and knowledge you have. What would be your advice to organisations around building a strategy for this?
So a wellbeing strategy needs to be tailored and targeted. We've talked about that. You also need to look at who you employ. And another thing that I've been involved in at Southern Cross is building a diversity, equity and inclusion strategy for the organisation. So I like to explain diversity is being asked to the dance, and inclusion is about being asked to have a dance.
Right.
There's a real difference. So for HR, that means about looking at who you're getting in, who you're recruiting, what do your long lists look like? Are they diverse? And managers asking if they aren't diverse, give me some more people to interview. But it's also looking at how those people fare once they are employed. What opportunities is everybody given to training, promotions? How long do people stay? So that's one thing we've been looking at in our DEI program is that DEI infrastructure, but then also supporting and celebrating the diversity of our workforce.
Yeah. So, I mean, from some of the results that are in the Healthy Futures report, some of them did draw attention to differences, perhaps based on gender or ethnicity. Any of those that you kind of really stand out to you as ones that, our employers might be like, want to have front of mind when they're thinking about wellness and diversity? Sure.
So there are different times in people's lives that are more stressful. So one thing that we've noticed is women returning to the workforce, people returning to the workforce after parental leave. How do you support them transition in? Thinking about minority groups. So, for example, this year during Ramadan, we had a Muslim employee who needed to pray every day. Right. Do you have a prayer room? Do you have a wellness room? Some space where somebody can retreat if they need some time? Or if you do want to do a wellbeing initiative, that it's done out of the boardroom or out of a sort of a personality-less, free meeting room, but you've actually got an environment which supports the wellbeing of your employees.
Very good. So, I mean, some of those sound kind of quite practical things and things that people could do, but there's always a kind of question from senior managers or owners about, so what's the payback for me of doing this? So beyond the kind of altruistic reasons that people might do it, how do you kind of explain that sort of payback typically?
So there is some really good evidence and literature out there on why having a diverse workforce pays off. Firstly, diverse teams have better problem-solving skills and come up with better solutions. That's one thing. Yeah. So that's one thing I like to think. If you have a homogenous team, they're going to come up with a very homogenous answer. Yeah.
Oh, very good. So that sounds sort of better in terms of innovation, for example. You're looking for new ideas.
Definitely.
That would be a sort of payback from that.
But in New Zealand, definitely we still have a glass ceiling. So one thing that Southern Cross is taking is the gender tick very soon. So Gender Tick also developed Mind the Gap.
Yeah.
So Mind the Gap is a report on the pay difference between men and women in New Zealand. And there is a gap still. And organisations now, some of the big banks, for example, are actually publishing their pay differences between genders and being committed to reducing that gap. So that's one thing that an organisation can do to be an equitable employer.
That's interesting, because that also kind of leads back to some of the sort of well-being. Because one of the trends I noticed, and I think it was in the Southern Cross report as well, was about what's important, and it was around financial well-being, concern about the kind of cost of living.
Yes.
Now, obviously, for organisations at the moment, sort of feeling that maybe we're in recession, and this is going to be difficult. So, what sort of things do organisations do to help with sort of financial well-being, sort of beyond just paying people more, which may feel difficult at the moment?
Definitely. We have financial planners with Raise who can sit down and provide planning advice. That's one thing. We can do seminars on that as well. That can be a good thing to do. It's about supporting people to use public transport, to bring their own lunch, all things that are prudent financially to do for individuals, but can also support people's well-being. How about people walking and biking, if that's possible, rather than bringing their car and paying for parking?
Oh, very good. Very interesting. So it sounds like that's stuff that's about sort of good sort of education for people around that type of finance. And tell me about sort of education around well-being in the workplace. What sort of things can organisations do, or do you recommend organisations do to help educate people, perhaps?
Sure. So I know one challenge that your profession has been having recently is the move back to the office.
Yes.
And what do you do with these big spaces that are, very, and what are people doing at home? But the research also shows that hybrid working actually can increase productivity and can be great for people's mental health. So it's finding a balance as an employer, is what works for the employee and what works for the employer.
Yeah. Over those 4 years, I think it is now, that you've been running the report. Obviously there's been changes over that time. What sort of stands out to you in those changes? Are there any that surprised you at all when you looked at the results this year?
I think we have to remember that we've had 4 years of incredible change in our world. So I think most people who are doing longitude studies saying they need a little bit more time to see the impact.
Yes.
We know that people have been really affected emotionally and psychologically from the pandemic. Yeah. So moving back into the office, adjusting to hybrid working, balancing the needs of an economy which is coming into a recession, all of the other factors. I think we probably need a little bit longer to establish a baseline of what our new normal is.
Yeah, because I mean, as you say, it's sort of been an unusual time, I suppose. And I think it started in 2019 and then 2020, sort of the impacts of the pandemic now. I mean, are there any things that you have any kind of inkling, like this is what I think's going to come next? What's if you were to take a bit of a view to the future, do you see any trends that are going to intensify, perhaps?
I think a focus on well-being of people being encouraged to bring their whole selves to work. Yeah, that comes back to the DEI space, that you are encouraged to be yourself, and we know that increases productivity, it increases a cohesive workplace, and that diversity is a good thing.
Yes.
So I think in the future we will see people working in hybrid environments. We've really embraced technology in that space. We will have people being encouraged to get up and move, during their day. All these things we've been saying, but they take a little bit longer to actually trickle down. We'll probably see special days of the year, or lunch and learns evolving into things which really permeate the whole organisation. So when you think about a policy or you think about something new, you have that eye for diversity and inclusion on it. You have that eye of what will this mean for my employees' wellness and their health? What will it mean for productivity?
Yeah. I mean, there's a very strong link, isn't there, really, between these two areas of your job, the sort of well-being area and the diversity inclusion. I mean, in your work, sort of what other parts of the organisation do you find yourself sort of particularly touching? You know, what other areas, perhaps?
Sure. So for me, it's about supporting the work of society for Southern Cross moving from being hospitals to healthcare. That's the main thing. Our strong partnerships with our society, so our insurance arm as well. So how can we really support people live a healthier life, a long, healthy life? And how do we partner better with our insurance arms, with the public sector, with the primary sector, to really create value in the healthcare that people provide, not just when they're sick, but when they've got that little ache and pain or they're starting to get a little bit down. How can we actually prevent people from having surgery? That's the stuff that gets me out of bed in the morning. So what in that preventative space, people spend so long at work. What can we do in that space? What can we do as healthcare providers to support people from getting sicker or getting injured? And then if they do end up in hospital, what's it like when they leave? What kind of stuff do they take home? In cancer care, what kind of mental health support are we providing people and their family and whānau? What are we providing in the way of rehabilitation through an awesome network of physiotherapists that we have once people leave after a hip or a knee replacement? What type of support are we wrapping around a person who may have had a women's health gynae surgery, both before and after? There's huge life changes. So the idea of us being able to wrap around a person and provide top-notch care to people through those different stages of their lives, I think is where it's going to be at in the future.
Ah, yeah. So that's a kind of another way of sort of slicing the demographics, isn't it, by stage of life and sort of time and what needs are at a particular point. So, I mean, that sort of points to, I guess, people in organisations being very mindful of, what's in terms of the demographic of their workforce, and as you say, then sort of probing into that to see what people need, but. You could probably go in with a few hypotheses about what it's going to be if most people you're employing are new university graduates, or if most people you're employing are more middle-aged.
Definitely. And just like New Zealand, in our population, we're ageing. And so we're going to have an ageing population who are probably going to be working for longer as well. So what are we doing to support our ageing workforce as well? So, and looking at those different life stages, one thing that we will be doing is a menopause guideline. How do you support somebody who is transitioning in that space in their life? Yeah. So that's one thing that we will definitely be looking in the future to support different stages of life.
Ah, absolutely. And so much of what you have just been saying, I feel, is very congruent with, I suppose, your original purpose that you talked about, which is this piece about, okay, it's not the bottom of the cliff, we're going further and further back, and also going broader as well. So it seems like not so much treating the effect as to treating the causes, perhaps.
Most definitely.
Very good. And, so... For organisations that perhaps don't have the resources that you do, or the expertise that you do, well, what's a kind of good place for people to start with this? If they're kind of feeling, right, we really need to do something about wellness and diversity in our organisations, well, what's a good place for people to start?
So your public health unit will often have a workplace wellbeing toolkit that you can use. So, and some DHBs have some awesome stuff on their website. So I would check out that. That's one thing. They have some great toolkits that can be accessed. If you're a Southern Cross Society corporate member, you can access the Being Well Plus platform, which enables you to grab content and have a wellbeing calendar. So they're all things that you can do. Also, in the diversity space, there are some fantastic organisations that you can partner with. So we've partnered with Pride Pledge. So we've taken a Pride Pledge, they have a stock take, and they really support you to increase your capability of supporting your rainbow staff and also your employees and patients. The Gender Tick is another awesome organisation. So there are lots of organisations that you can partner with as well that can support you on this journey.
Right, so organisations that you can partner with, expertise in specific areas, if you identify them as important.
Definitely.
Sounds like you're saying as well, there's resources that are available at no cost for organisations to access.
Yeah.
So,
and with that tapping into your networks
yeah,
as well. So, I mentioned the menopause guide. It's amazing that people are sharing the work that they've done on policies and guidelines very freely.
right,
So I've found if you ask, people will give.
right.
And you're able to either start from scratch or review and compare. And so that can make for an HR professional in this space a lot easier.
Yeah. Okay. I want to sort of roll back to something that we found in the NIB EMA survey about sort of about mental well-being and about the extent to which people sort of felt stressed at work.
Yeah.
And the figures for this were extremely high. Yeah. So tell me about the sort of figures that you found and what that sort of looks like. Yeah.
Well, I don't know if we were using the same tool. So, and also maybe the question was asked differently about general life versus work.
Yeah.
Yeah, so we know the utilisation of technology is fabulous, but it means we don't switch off.
Yeah.
That people multitask to the max. There's all of those things. So some people are going down the path of encouraging mindfulness. I know you had Zach Parrish on one of your podcasts talking about, bringing people back, encouraging walking meetings or people to actually have some designated time where they get out of the office and they have a walk. All of those things that you can encourage, and as leaders to also to role model that.
Yeah. Well, that role modelling thing is so interesting, and yet sometimes it feels so difficult to do.
Definitely.
And I think, I often hear about the group that feel most affected in the workplace is the sort of middle management sort of level.
Yes.
Yeah, this your experience too?
Yeah, you've got the push from above and you've got the push and the pull from below. So you're stuck in the middle of the organisation.
Yeah.
I've been an operations manager, so, I've been there.
Yes.
It's a very difficult role.
Yeah.
So supporting yourself, not to burn out,
Yes.
and to carve out your time so you're efficient and you're effective. When you are with your team, you're present.
Yeah.
Some of the best leaders I've seen are the ones who are present and they're with their people and they're doing one thing at a time really well.
Yeah. And so what does that look like, someone being sort of present in that way? What's the, what does somebody need to do to kind of demonstrate that?
I guess it's technology, right? It's slapping down that laptop lid and putting your phone away. I think that's a real, and having, building that culture and leading that, when we meet, when you have that sacred time, whether it be one-on-one or team, you are actually you're modelling that. Another thing people are doing, and something that we're doing at Southern Cross, is bringing in a waiata at the beginning of your meeting. Right. There are some incredible Te Reo waiatas that, if you put with the English translation or you encourage people to start to learn some Te Reo, they've got a real ability to ground and centre people at the beginning of a meeting.
Well, that's pretty interesting, because that, again, is another link, I guess, across from your diversity inclusion hat to your wellbeing hat. Also relates very much to some research that Jared Haas shared with us on our EMAcast, where he talked about being a huge benefit when Te Reo was used more in the workplace and were made more acceptable to do. Yes. Yeah.
So it's the same. We think about the journey of Te Reo being recognised as a language in New Zealand from the people back in the 60s who were not allowed to speak Te Reo. And now you're encouraged and it's embraced. it's embraced.
Yeah, absolutely. So, I mean, for those middle managers,
Yes.
like that, I think there's some great sort of practical stuff there
Yes.
for thinking about people as individuals, what to do. So somebody comes in to have a conversation, closing your laptop or turning off your phone or just turning it around and kind of looking at them and talking to them. Great sort of practical stuff that were very easy to do, but very easy to forget to do as
Definitely.
well. And that's good as a middle manager, kind of thinking of it for yourself and doing that. At an organisational level, what can organisations do to help middle managers to behave like that or to do that?
Yeah. One thing that we went on a senior leadership course recently, and one of the speakers really resonated with me. He said that the first 4 minutes, don't talk work. Just build that relationship. Ask somebody how they really are. Ask them about their family or what's happening in their lives, and it helps you build that relationship and it helps you ground and centre. So when you do start talking work, you start talking shop, it's done from a place of empathy. You know what a person is going on in their life. You can have that wider understanding of the context within somebody is sitting in, and then going from there.
Very good, yeah, very interesting. So you could establish, it sounds like some of the things here are about perhaps establish some organisational protocols about how you do things that just make it easier and more acceptable to do that.
Yeah, definitely. And then in time it becomes the way your organisation functions, the way you live and breathe.
Yeah, absolutely. So, at the moment, are you somebody that feels that this attention that's being given to sort of well-being and wellness in the workplace, are you seeing this as something that's occurring across lots of organisations and as kind of positive trend, or is it something that there's any resistance to?
Definitely. I think often when people come to us, it's the health and safety role that first makes that initial call.
Yeah.
And they ask about specific, often occupational health things that they need for their health and safety program. And we can definitely assist with that. So we're working with a lot of small to medium-sized businesses on quick fixes for individuals who need assistance.
Right, yes.
With the wellbeing dollar, and it depends how much you have, you can do great stuff for your organisation in a real targeted way. So coming back to the idea of a subsidised gym membership versus working with specific people in your organisation. So who can really get the benefit out of a wellbeing program. And people are starting to think more like that. So working with a group of senior leaders who need specific leadership training, your middle managers who may need support around resilience and that push-pull that we talked about before. And then a real focused approach with working with specific people. Some of the work, the customers we have factories, and some of those people may not be insured, so they don't have the benefits of of a membership with an insurance company. So what I've loved is that they have given their factory workers time to have a health check.
Right.
That takes some planning. You've got a production line, and you give that person half an hour off that production line to go and have a conversation. Yeah.
Yeah.
And then from there we can start to build some really good health programs. So for example, having a diabetes nurse come in once a month and having a GP video called in to talk to the person during that consultation, and come up with lots of innovative ways for real targeted approach to supporting the health and well-being of employees.
That's really good, because what you've just done for me is sort of bring to life that piece around, health and well-being, kind of gym memberships for people that go to the gym anyway, healthy food for people that are eating healthy food anyway. It's kind of nice, but it doesn't really feel like it's going to shift the dial that much. Whereas what you're talking about is really nitty-gritty health problems.
Definitely.
And sort of helping people to overcome those.
Yes, definitely.
And be productive both in the sense of productive at work, but also productive members of the community and so forth.
Definitely. At the beginning of this journey, we said that we would never be about smoothies and yoga classes.
Right.
And smoothie and yoga classes are great, but we need to penetrate deeper when we actually think about wellness.
Yeah. And, I think, again, going back to your work experience, coming into this as a kind of health professional with that kind of lens on it, do you feel that, I suppose, the HR part of the sort of wellness industry, if you like, does that need to kind of speed up or refocus somewhere? Or, you must come with a kind of very critical, perhaps professional lens to it at times.
I think it depends on your organisation.
Yeah.
So it depends where your health and safety person sits and how close they sit to your people and culture department.
Right.
And where does your wellbeing person sit? And do those two people talk?
Yes.
And everybody seems to be doing it slightly differently. Is your health and safety person also your wellbeing person?
Yeah.
And how are you skilling them up to really understand about how you can design a meaningful and effective wellbeing program. So often we start to work with a wellbeing coordinator or health and safety coordinator, and then we'll work with the health HR leaders, and that will help them have that insight and knowledge from the more senior people in the organisation to just give them some direction. And then when we can work with the health and safety and wellbeing coordinators to also provide them resources and ideas for how to design a program with that will have the most impact.
Yeah. Well, I think it's an area where we're going to see a lot more attention and interest because we do a sort of assessment with organisations around the sort of HR maturity. And one of the areas that comes out there is most New Zealand organisations that we survey. So these are typically a sort of 50 to 250 employees. And typically what comes out there is where we've got questions that are about what I might call traditional health and safety. Organisations are like, this is really important to the business, and we do the right stuff.
Sure.
They basically say that.
Sure.
With the stuff that's more related to well-being and wellness, what I've noticed there is certainly a shift in terms of how far people see that as important, getting more and more important. But frequently, those are the questions where organisations are like recognising they're not so mature, if you like, and that they need to do something. So there's this gap there between what they recognise as their current capability versus what the business needs.
Sure, definitely. And there's only so much you can do. So maybe you start with flu vaccinations. Or supporting COVID vaccines. That's a huge start. Making sure that you've got your occupational health vaccinations right. If there's a risk of tetanus or hepatitis, what are you doing if you've got seasonal workers coming over for 9 months a year? How are you supporting them? So in a small business, that might be about, and so that you use your dollar in the most effective way. And definitely, there are free resources out there, and there are ways like listening to your podcast, like Jared's podcast, where you can really think critically around if you've just got one person doing health and safety and maybe well-being as well, and maybe they're not full-time in an organisation of 200 to 400, how can they be skilled up so they can present the best offering to your employees?
Well, yes. I mean, it's interesting you say that because sometimes the whole thing is really embodied in one person in an organisation, perhaps of 100 or so. There's one person in there, and really probably the three things that they're rushing around doing is recruitment, because at the moment they can't find anyone, so that's bothering them all the time. They're dealing with poor performance because managers have perhaps not been skilled up to do that, or perhaps it's not been dealt with over the last few years. And the other thing is very much around health and safety and kind of just what do I need to do there on a day-to-day basis. And what I notice about the discussion with you compared to some of the other conversations about wellbeing is a real kind of back to basics around things like to do with health that I go to the doctor or the dentist about, these sort of things.
Yes, definitely. Yeah. So unfortunately, more and more people in New Zealand don't have a doctor that they'll go and see regularly. You know, we've got a huge shortage of GPs in New Zealand. So when we look to Australia, more businesses are actually paying for general virtual GP care. So that's something we can do through Care HQ. So we can do that for GP medicals for returning to work after an injury. Or also if somebody is sick and at home and they're getting to that point they might need antibiotics and they need to check something out, that's a great time to access virtual care. So Southern Cross members can access Care HQ for free, but it's also something that we can provide in a voucher system for employees. So that might be something really useful for your small to medium-sized businesses.
Absolutely. So I guess we've come round a whole range of sort of areas, and I'm so amazed with the sort of depth of knowledge that you have around these. If you were kind of wanted to give a message, I suppose, to sort of HR managers out there or our small business owners about sort of wellness at work and, what a kind of great sort of first step this is or what it is that they could achieve by giving more attention to it, what sort of message would that be?
I think that investing in your employees' well-being will hopefully keep them working for you. That's one thing. They're less likely to leave if they feel valued. They're more likely productive if they're well. They're the cornerstones of well-being. And if you do it right, you will see a change over time. And if people are encouraged to bring their whole selves to work, that you will get people really engaging in their job and in the team a lot more genuinely. Like, gone are the days where you have to leave parts of yourself at home. And that diversity and creating an inclusive environment leads also to more productivity. Well, I mean, that's a great output. I think everyone would want that. People would want their employees bringing their whole self to work. I think it sounds like it's bringing their well self to work as well and being more well when they're there and being more likely to stay working for the organisation and be engaged and motivated while there. Definitely.
There's a lot of powerful wins from it, Kate,
aren't there? And also engaging people on the endure and, whether organisations do a pulse survey or how they consult with their people, and ask them before you go out and spend a whole lot of money that you think is great. Ask them if they'll use it. If they think it will be worthwhile or if you could do something differently. And so then that will help you take a much more targeted approach that is likely to get engagement, and that is going to also turn into tangible results.
Fantastic. Well, thanks so much for coming in and sharing such expertise and knowledge today. It's been very interesting to delve into these areas and circle round them and come back. But that's been very helpful.
Great. Thanks, John.
And I'd like to, obviously thank you, Kate, again for coming. I like to think that everyone that's watched this has got some great sort of practical ideas of things they can do, well aware of the resources that there are to support them. I've really encouraged people to have a look at that the workplace health report that Southern Cross have done. There's some fascinating data in there. So much data it kind of overloads us all, but you can find some great practical things in there. But I'd just like to thank everyone for listening today, and I wish everyone well on their journey to making workplaces more healthy and well and diverse. Thank you.